Okay, so let's talk about some breastfeeding challenges, okay? One of the biggest concerns for moms is to knowing your baby is getting enough. Everybody worries, is my baby getting enough? Oh, I'm starving my baby. You cannot see this milk go from the breast into the baby. So that's always a concern. So how can we tell if we can't see what goes in? So your baby is going to be content, okay? They're not going to come off the breast and be like, rah, okay? They're not going to be, they're actually going to have that nice deep sleep after they're done feeding. You're going to be breastfeeding 8 to 12 times. You're going to keep track of this information. In the hospital, we actually give you a log where you can write down every single feeding, even if it's an attempt, and then any time the baby pees or poops. So this is the best way to know that your baby is getting enough, okay? So the first day or two, your baby's going to have stool that looks like street tar, okay? It's called meconium. That is what is produced when the baby digests that amniotic fluid. It is really thick, it's sticky, and you've got that for the first day or two, okay? As the baby's getting the milk that they need, okay, then that digests through their body and it changes the stool, okay? So you're going to want to see 1 poopy diaper on the first day, you're going to want to see 2 on the second, and a good 2 to 3 on the rest of the days, but they're going to change. You're going to end up with that yellow CD, which is on the right side of that slide there. Babies lose weight the first 3 days. They can lose up to 10% of their birth weight as long as we're seeing the pees and poops. So we want to see 1 wet diaper for each day that the baby is old. So day 1, we want to see just 1 wet diaper. Day 2, we want to see 2. Day 3, 3, 4, 4. And then when we get to 6 days, you want to see 6 to 8 wet diapers each day. And those won't be where you have to really look at the diaper to see if it's wet. They will be heavy. And that is very normal. So we're looking for, is the baby satisfied? Does they have the right number of pees and poops? Are they eating 8 to 12 times a day? Is the mouth moist? That's another indication your baby's getting enough. And is the weight loss less than 10%? Then you're probably doing fine, okay? So we have some issues that you'll run across. Everybody has different anatomy again, so there are things we can do to help you. If you are concerned and you have flat or inverted nipples, that is when the nipple is kind of flat like this. Sometimes if you can roll it, just kind of pull it a little bit, that's going to pull it out a little bit, but that doesn't happen for everybody, and that's okay. Sometimes it is flat like this, and if you compress the breast, it actually goes in, okay? So that is more of an inversion, okay? So there are things that we can use. You can use a pump. You can use that pump and it will pull the nipple out. Just use it for a minute or two, and then you can take that off and you can try to get the baby on. You can hand express. That's going to help, and we'll go over that in a later section, but that will help to pull that nipple out also. Okay, they have things called latch assist, which looks like a bike horn actually, and it's just a really simple thing over the counter that you can get that cups over the nipple, and you kind of just squeeze it a little bit and it pulls the nipple out, so you can do that. We also have a nipple shield, which is a really thin plastic, flexible material, but it keeps the shape of a nipple for the baby. So when you go to put this on, you're not going to just put it on. It fits beautifully on this, but it doesn't go on that way. So I am actually going to show you, first I'll show you this way. So you're actually going to turn it inside out, really kind of stretchy, so that it is half, kind of like a sombrero kind of thing. And then you'll put the open part of it over the nipple, and you will roll it as you put that on, and it'll roll so the nipple's actually inside the nipple shield, okay? This can be used, but it's a tool. It's not something that you want to use all the time, okay? If you are using this, you're going to be seeing us, okay? We're going to be there to help you. Also, if you are using this, I would recommend that you do pump, because it's possible that the baby's not getting all the milk they need, and so you're going to want to supplement the baby with that milk after you pump, okay? So then we've got sore nipples. That's what you hear. Oh my goodness, I heard it hurts so bad. It can if you don't have the baby latched on right, okay? But if your nipple is cracked, bleeding, raw, you've got a stripe of a bruise or a scab, baby's not getting on deep enough, okay? Sometimes it's something that's in the baby's mouth or the way they are sucking. They can have an uncoordinated kind of suck, or they can be chomping, or they can have problems with their tongue, and that can cause some damage. So there are things that you can do, and the first thing I'd recommend is making sure that you're getting that help to get that good latch, okay? That's going to be able to prevent it, and to help it, you can actually express a drop of colostrum and rub that in. Colostrum has living cells. It's going to help it to heal, okay? Sometimes you might have sore nipples because you're using a pump and the flange size is the wrong size, okay? We'll talk about that in our pump section. If you are using that, the colostrum to help heal that nipple, after that dries, you can use some lanolin cream, you can use coconut oil, all of these things. There's like a mother's nipple cream that you can get over the counter. These things, you don't have to worry about it harming your baby. It does absorb into the skin. Now, if you just put this on and the baby decides they want to eat again, I would wipe it off. But in general, use some colostrum, then use one of the creams or the oils. And then if you are having such sore nipples that you're having trouble with the baby, you can actually use a nipple shield again, or you might end up having to pump a little bit until we can get past whatever problem is causing that. So let's talk about once that milk comes in. It is called engorgement. Day 3 is typically the average time, but 2 to 5 days is normal. Your breast gets so full that it's like really hard. It can actually flatten the nipple because the milk is now pushed out all the way, okay? So one of the best things for engorgement is frequent small feedings, okay? Get that baby to the breast. Let the baby empty what they will. Again, most moms make more milk than their babies ever need, so this is a time of adjustment, okay? So you can use warm compresses, take warm washcloths. They have these little gel things now. You can put them in the microwave, just make sure it's not too hot, and it goes around the breast. You can do that. You can get in a hot shower, let that water hit your back and roll over the chest. You probably do some leaking. That's going to be actually beneficial because it's not stimulating any more milk production, but it's actually doing some relief for you. And then once you're using those warm compresses, you can massage. Now this is going to be really tender, but you want to massage, especially while the baby's at the breast, okay? That's going to help that drain. Really avoid pumping unless you're miserable, okay? And only pump until you can take the pressure off of it. You want to make sure you're getting the baby latched on well and the baby's emptying it properly. There are some other things you can use, but you got to remember this will also lower your milk supply, okay? So you can actually use green cabbage leaves. And I know everybody thinks that's just a wise tale. No, it actually does help with swelling, okay? So you just kind of wet the leaves, kind of crinkle them a little bit, and you can put them inside your bra and just leave them on for 10 or 15 minutes. The other thing you can use is ice, and that's, again, only if you are absolutely miserable, baby's fed, and you still got a lot of pressure, go ahead and put some ice on the breast, and that will help to take some swelling down. Sometimes you might feel a rod, like hard rod, like your finger, inside the breast. And that's usually a blocked duct, okay? So if you've got a hard area inside there, as the baby's feeding, you can do some massage, just circular, gentle massage. And you can use warm compresses for that. One trick that I've heard recently is if you actually have an electric toothbrush, the back of that toothbrush, if you kind of just put it on the area and let the vibration hit on there, it actually helps to break it up. So nice little interesting thing. So what happens if you are dealing with this? You've got this duct, you can't get it to clear. A lot of times what happens is you'll end up with an infection. So mastitis is you're going to have a red area on the breast. It's going to be warm to touch. You're going to feel like you have the flu. You're going to have a temperature. You're going to have chills, body aches, that kind of stuff. It is a bacterial infection. It is not going to harm the baby. So you want to make sure that you're still emptying your breast, okay? But you do need to call your doctor, let them know what's going on, and be seen. They can assess you and get you on the proper antibiotic. You can, again, still keep breastfeeding, use those warm compresses, use that massage, and that's going to help as you get the medication that you need for that too. There's also a possibility of getting a yeast infection, which is just an overgrowth of the candida organism. And usually it's from a warm, moist area. Well, if you are having a lot of leaking, moms will use some of these pads and they leak and they put it back on after they feed, and if you leave this on too long, it can be an area for organisms to grow. So definitely change those pads at least with every feeding if they're damp at all. But typically in the yeast infection, you'll see either the baby has white spots all in the mouth, on the lips or the cheeks, tongue, that you can't wipe away. Okay, the breast will have really red, like beet red almost. It can have little bubbly rash, and moms will describe it as really sharp shooting pains. Okay, so definitely if you're having any of this kind of stuff, you want to call for some help. Call your doctor, call lactation. We'll be glad to help you through that. Both mom and baby need to be treated if you have that thrush or the yeast infection. So some of the baby challenges. You got a sleepy baby. That's a challenge to moms at the beginning. So definitely trying to wake that baby up. We're going to show you when you're in the hospital. We'll give you some demonstrations, but really unwrapping them, really stirring them. A lot of times I'll see moms that are just holding a baby and kind of going like this to try to wake them. Well, that's kind of soothing. So you really have to just kind of let them be off by themselves, unwrap them, and go to the bathroom and then come back, and they'll probably be ready to go. Another thing they do is cluster feedings, and that is challenging because it's usually the day before your milk comes in or during a growth spurt where the baby just seems to be feeding every hour. They're feeding, and you get weary, but you hang in there, and then usually within 24 hours, everything's back on track again. Babies can have an uncoordinated kind of sucking. They can have chomping or kind of thrusting and pushing out the tongue. And then sometimes your baby's ill and baby has to be in the hospital. You're not. So being separated are things that can be challenges too. And any of those things, we're going to be with you. We're going to help you get through that. Okay. Babies will go through these growth spurts, usually around 2 to 3 weeks, which is a time when you've now gone through all of the beginning changes, that engorgement. You're not feeling that really horrible fullness. It's just full before feeding, empty after. So when they go through this growth spurt, all of a sudden they're wanting to feed again. And a lot of moms will give up at that point because they think they don't have any milk. But that's not true. It's just they're going through a growth spurt. So again, keep increasing those feeds, usually a day or two, and they're back on track. We're going to go on and talk about breast expression, hand expression, and pumping in the next segment.